Brian has two heads. He's not a fan of using both of them at the same time because most of the time it doesn't turn out that well. One of the head has no brains and tends to dominate in a certain particular activity. Now his lady trusts whatever head Brian is using during that particular activity. On this episode of Neglected Medical Topics, what should you do immediately after unprotected sexual intercourse? And we're going to look at 8 things that you can do. And I'm talking about a female and a male. And before we start, what is that one thing that you are led to do by the head that doesn't have the brains? There is a fancy name for that, post-nut clarity. Should be fun. Now the first thing is inspecting the crime scene, and this goes both ways. You look for anything physical on the organ that can tell whether this guy is having either genital warts or HSV or boils. Now for HSV, herpes simplex virus, you might find that some crusts or some lesions or blisters that will contain fluid inside. Also for the HPV, which is where you get the warts, you might find that there is no that liquid. It's slightly different. I'll try to put images here and try to say, I'm not sure whether YouTube will like that anyway. For HSV and HPV, there is nothing much you can do about that once you acquire that infection. The least you can do here is at least to know where you actually got it from. Now, if you give it a side eye and you discover that you have some boils down there and you are there, definitely you might acquire the same. So the least you can do is just going to a hospital and getting antibiotics for the same so that you don't get that infection. Bacterial infections are usually preventable. Viral, we have very few that you can get a prophylaxis for. While at it, you can try to assess the general mood, whether it's motivated or less motivated or it's just sad. Oh, sorry. Okay. Now the second thing is tests. Take advantage of a situation that usually happen after sex, whereby there is relaxation of the pelvic floor muscles. So during this time, chase to the washroom and back. Take advantage of that urine and test for pregnancy. That test is actually 50 bob, 50 Kenyan shillings. So 50 cents in US dollars. So just do that. Now, 2 things can happen here. She's already pregnant. This means you are the new uncle in town. Second can be she's not pregnant. If she's not, 2 things. Is it during her fertility window or outside her fertility window? Now, if it's within her fertility window, 2 things here. Is it during and slightly after ovulation, or it's before ovulation? If it's before ovulation, then you can take an E-pill, emergency pill at this point, and she's not going to become pregnant. If it's during her ovulation or slightly after ovulation, 2 things here. You sit down and pray, and it works, because most of the time E-pills do not work during this period after ovulation, slightly after ovulation. So you sit down, that's number 1. You sit down and pray and it works, so she's not pregnant. Or you pray and it doesn't work and you are the new dad in town. Congratulations. Number 2, if this is outside her fertility window, you can just go home comfortably and make sure you tell Dante. The second test that you should do is a HIV test, assuming you don't know each other's status at this point. And this is the reason I usually prefer you start, first of all, think with this head before you shift to the other one. Now, 2 things can happen here. 1, positive, that's when you go for a prophylaxis. This is PEP, before 72 hours are over. PEPs, this is post-exposure prophylaxis. You take those drugs, you're not going to get HIV. It can be that they are negative, he or she is negative. Now, if that's the scenario here, you're not out of the woods yet, because we have 2 scenarios here where someone can test negative and they are positive. One, which is a little bit favorable, is when that person is actually, they know they are HIV positive, they've been taking ARVs so well to a point where even the antibodies don't find anything to do in the system, so decline. So when you test that using the normal kits, you find that they're negative. The good thing about this one is also the chances of infecting other people will reduce significantly. Now, there is another scenario whereby this is the most dangerous, the most infectious stage during the Windows period. This is when the body doesn't actually know that you have HIV. You have a lot of those viruses in the body, but the immune system is not even aware that they are there. The most infectious, it will test negative using the normal kits. Unless you go with your partner and you get tests such as we have ELISA, we have PCR methods, which they are quite expensive, but they are better than this other test here. Or you can just use protection once you meet your partner, and then you take time, like 3 months. After those 3 months, you'll find that the body has already identified that there is something new in the body. You have antibodies that you can test that person, and they turn out to be positive for HIV. If that person is not there to be tested, or maybe they decline to be tested, the best thing that you can do is just taking PEPs. Just go get the drugs, take them for 28 days. It's better safe than sorry. Number 3, consent. Was it given or not? If it was given, so 2 people who are having fun, go ahead and have fun. And remember who is paying the rent to that house. And it will depend. Is it an away match or a home match? Anyway, let's go to the other one. If the consent was not given, don't do anything. Don't shower. Don't do anything at all. Just go report. And then after reporting, directly go to the hospital for collection of evidence. Actually, we have emergency numbers that you can call to report such cases, and we have dedicated police departments that will take care of such scenarios. So one thing I want you to do is don't shower and don't tamper with anything that was there. The bed sheets, leave them that way. Don't shower. Whatever clothes that you are wearing, don't change. Just go to the police station with that, and then go to the hospital for collection of any evidence that might help in the investigations. Number 4, urinate. This is quite beneficial, especially for men, because urethra will be used for both for passing semen and also passing urine. So by urinating, whatever might have lodged inside, like bacteria, might be dislodged out. It's not 100% way, because we have fimbriae in bacteria, meaning that it can use those to stick to the walls of the urethra. But those that will not have stuck to the wall might not get a chance to do that, because you'll push them out through urine. At the same time, take in more water so that you urinate more. Ladies, in as much as the activity will be in the vaginal canal, not in the urethra, they are very close. So chances will be that some of them will be lodged inside, and your urethra is quite short. So getting a UTI or bladder infection is quite easy because of the urethra. It's quite short. So try to urinate and drink a lot of water. In as much as due to relaxation of the pelvic floor muscle, you will tend to go to the washroom quite frequent. It's a reflex action. Number 5, was he having a helmet on that other head that doesn't have brains? If he did, is it still intact? If it's still intact, then he needs to know, or he needs to evaluate whether is this his place. Is it a home or an away match? If it's home match, we can just go to the washroom, shower, and then come sleep. If it's an away match, you need to decide, are you the one who's paying the rent? If you're the one who's paying the rent, then you can just go shower, come sleep. If you're not, if it's not intact, then you need to evaluate the situation, damage control. You do the things that we mentioned up there, like testing and getting to know if this is during a fertility window, if it's safe to still take e-pills. And by the way, there is this other one, Postina 2, which promises that even after ovulation, it's able to prevent you from getting pregnant. I don't know how true this is, but I'm usually very skeptical about e-pills. They most of the time don't work after ovulation. Number 6, for the few of you who decides to use farm tools and equipments for all the wrong reasons, go ahead and wash them and disinfect them. We have alcohol that you can use. It will take care of most of them, 70% alcohol. You also have povidone, which is my personal favorite. You can buy that from any pharmacy. Just go buy that and wash the tools that you are misusing. You can buy that one, or even use Jik. It's quite effective to wash your farming equipment waiting for the next planting season, and especially if you share the tools, this will go a long way into preventing the spread of any infection, should there be any. And even sharing normal flora can cause an infection in another person, but that's a topic for another day. Number 7, shower. And don't forget to use a mouthwash, especially for those who decided to use the wrong toothbrush or the wrong dental floss. I don't want you to introduce a new strain of bacteria in your mouth, someone else, normal flora. We don't want to introduce that into your mouth. I've seen some of you kissing your kids or maybe your friends or other people out there. I don't want to make it gross. So shower, freshen up. Number 8, you left the crime scene, and this is the aftermath. 2 to 3 days after, and you discover you're having a discharge or getting itchiness. The discharge can be smelly or maybe colored. it's high time you go to a hospital to evaluate what flavor of UTI or STI you acquired so that you can get proper medication after that, proper treatment. Make sure you also notify your partner so that they can also seek medication. We have some STIs and UTIs that can just stay somewhere hidden in males and some others in women. It's quite important for them to also get treated for the same so that it doesn't spread and also it doesn't get to affect them negatively, because you know we have some STIs and UTIs that can render someone infertile. I hope you enjoyed this one, but you have to know that YouTube doesn't like such topics, neglected medical topics. Doesn't like them as much. So this video might not get monetized. So the best that you can do to support whatever you're doing here, if you enjoyed, is liking the video. You can go as well as interacting in the comment region and also share to the people that you do love. And also make sure you subscribe and you ring the bell because they have a lot more where that one came from. See you in the next video.